Good afternoon, everyone, and welcome to a very special session that is very close to my heart. This is a topic that's dear to me because of a person suffering from an autoimmune disease. And I've always wondered if what I'm being offered as a treatment would be the same if people had listened to what I wanted and what I'm comfortable with. This is a question millions of patients ask. There have been attempts to address this in many ways, but no one really has made an effort to go to a body of patients to understand what their journey really looks like. At IAPO, that's what we have always wished to do. Listen to the patient voice and bring that to the forefront. When Pfizer Upjohn offered us the opportunity to understand this patient journey in a scientific way, we were beyond thrilled. MAPS, an acronym for Mapping the Patient Journey Towards Actionable Beyond the Pill Solutions, is a unique initiative by IAPO and Pfizer Upjohn to explore the patient journey through data collected from the field and validated by experts, both patients as well as healthcare providers, and distill that into actionable points that stakeholders can take and run. The non-communicable disease, or the NCDs as they are called, patient journey is often misunderstood as a linear journey that's being simple and is just a transaction between healthcare providers and patients. MAPS takes a critical look at this definition and looks at the patient's journey's touch points and uses data to validate this journey. An important feature taken into consideration is multimorbidity and polypharmacy within a very, very fragmented healthcare system. MAPS keeps the patient at the center and describes a methodology to collect and analyze data that will identify key gaps in the current systems and attempt to find solutions and recommendations through a 5-step journey map. The methodology has wide applications across a spectrum of NCDs and diverse geographic locations, identifying new areas for research and providing guidance for policy changes through its gap analysis. While we work on the methodology and application for the data collected, today's launch is about a white paper focusing on the concept and providing a crisp introduction to the overall idea. As a patient advocate, I'm excited for the launch of this paper and look forward to the analysis and recommendations for low and middle income countries. A country that I come from is from the LMIC. This could be a simple yet powerful method to find locally relevant solutions that are acceptable, adaptable, and easily customizable within existing policy frameworks and budgets to achieve tangible results to decrease the burden of NCDs. We have 2 exciting speakers who will lead us through more details about MAPS itself and the white paper being launched today. Our first speaker is Dr. Amrit Ray. He needs no introduction. He's a physician, researcher, and a corporate executive committed to advancing scientific breakthroughs and championing patient-focused, ethical healthcare practices. Dr. Ray is a global president of R&D and medical at Pfizer Upjohn. His instrumental role in developing, launching, and catalyzing access and impact for medicines combating debilitating diseases has been recognized by patients and governments. Dr. Ray was previously the Chief Medical Officer for Pharmaceuticals at Johnson & Johnson and a hospital doctor in Britain's National Health Services. Our second speaker is Manasi, who is currently the President for Emerging Markets at Pfizer Upjohn. He is a member of Upjohn's executive leadership team, and in his current role, he has the privilege of leading an organization of more than 2,000 colleagues across ASEAN, Africa, Middle East, and Latin America in the fight against non-communicable diseases. Manasi believes in the power of partnerships to address the NCD burden and is focused on leading the conversation with multiple partnerships to shape policies and improve NCD care. I now hand over the floor to Dr. Amrit to speak a little bit about the MAPS and the white paper in itself. Over to you, Dr. Ray.
Thank you very much, Dr. Devi, for all that IAPO does to advance the voice of patients globally and for giving us a platform through this Congress to focus on the issues that matter to patients and how to advance solutions. Your leadership really stands out. Patient centricity or patient-centric healthcare have long been buzzwords among healthcare stakeholders, but there is a gap. Patient-centric intentions have still not universally translated into patient-centric care. And putting people at the center of healthcare systems is the only way we will truly be able to effectively manage the health crises of our time. The burden of NCDs has, for all of us at this meeting, become one of the most pressing health crises. NCDs are responsible for 2/3 of all deaths worldwide every year. After this Congress, everyone will go home and remember that every 2 seconds, someone dies prematurely from an NCD. They cause significant morbidity and disability, and they disproportionately affect people in low and middle income countries, in which 4 out of 5 people live with an NCD. Now, despite NCDs being often preventable and largely treatable, more than 50% of the countries lag behind the WHO's Sustainable Development Goal to reduce premature mortality by 1/3 by 2030 through prevention and treatment. One solution for these complex and varied conditions must balance the variety of issues, and that includes both the prevention of risk factors and the delivery of quality, cost-effective healthcare. There's a real need here for a patient-centric approach that shifts the focus from just the disease to what is needed along every single step of the patient journey, from prevention through to risk factors and control, adherence, many factors. Now, we believe that a key step in facilitating this patient centricity is to create a framework to gather, assess, validate data anchored around the patient journey. Now, at Pfizer Upjohn, we want to be a constructive voice, and we are very proud to make a contribution and to accelerate this shift by unveiling the MAPS initiative. MAPS, as Dr. Davies said, stands for Mapping the Patient Journey towards Actionable Beyond the Pill Solutions. This scientifically led initiative is a collaborative effort between many functional teams and external partners to build a patient-centered approach towards the care of NCDs. MAPS really reflects Upjohn's global commitment to reducing premature deaths from NCDs and our deep passion to be a leader in using scientific evidence to convey the importance of the patient voice in NCD care to healthcare providers, healthcare systems, and to policymakers. At Upjohn, we are very excited by the opportunity of MAPS to help contribute to the management of NCDs through a very multi-sectoral, patient-centric, and locally relevant approach. One of the benefits that we see from MAPS is that it will facilitate quantitative benchmarking, okay, of different aspects of the patient journey. And this data-driven approach will give us insights, for example, into suboptimal outcomes, which could be improved by setting in place disease-specific priorities. I feel very optimistic about the application of this approach for NCDs, but also beyond NCDs. MAPS also, to your comments, Dr. David, has a specific utility in low and middle income countries, where there are many significant challenges to the provision of effective and efficient healthcare. My colleague, Mr. Manasi Tades, will touch on this further in his remarks. And at the end of this session, we're also excited to unveil a video that further explains the MAPS initiative. We look forward to communicating evidence that's gathered through MAPS in presentations, in publications, to be as transparent as possible in sharing evidence-based recommendations that come from the scientific assessment of these gaps, and to try and integrate those recommendations with strategic actions and initiatives. Thank you again for inviting us to share this initiative with you today. Now, Manasi will share a bit more about the importance of MAPS in low and middle income countries.
Thank you, Amrit, for that great explanation of MAPS. Thank you, Dr. Devi, for this great opportunity to continue to partner with IAPO. Before we discuss the significance of MAPS for low and middle income countries, it's important for us to really place the full burden of NCDs into perspective. As Amrit pointed out, 4 out of 5 people with NCDs live in these low middle income countries. The majority, 85% of them, will have premature deaths in these LMICs. This is obviously unacceptable, as many of these chronic conditions are preventable and can be properly diagnosed if managed appropriately. So there are a number of significant challenges that we face in providing this effective and efficient healthcare in these LMICs. Many healthcare systems are fragmented, as many of you know. Patients typically have comorbidities requiring engagement in multiple stakeholders. The system is not well integrated as such, leaving the patient, as Dr. Devi described a little bit at the beginning, as the only constant. And many healthcare systems have not fully adapted to the long-term nature of chronic disease management, and instead are continuing to focus on an acute approach. Another trend that we see across LMICs are limited resources dedicated to primary care systems. This means that routine screening for chronic conditions is not occurring. This results in late diagnosis, especially for conditions that are asymptomatic, such as hypertension. So it's important to note with ample resources, the results are not largely very different without a strategy that is customized to the nuances of the local environment, and are likely to come with high cost, but not be as effective, for sure not efficient, nor timely. This is what historically has taken place, and I'm speaking not only with evidence, but also from experience, given my responsibilities in these markets. Oftentimes, guidelines for clinical practice are guided by recommendations based on data from Europe and North America. While this information is extremely useful for some of these countries, it's not fully relevant without understanding the local needs of these LMICs. Locally relevant data, accounting for cultural differences, dietary practices, and most importantly, access and availability to quality healthcare and medicines should be taken into consideration when adopting guidelines to the local environment to drive NCD-specific action plans. This is where MAPS comes in, and MAPS helps to address this gap, as Amrit detailed. MAPS highlights the importance of placing the patient at the center of the care, enabling them to be active participants, while also engaging multiple stakeholders along the patient journey to ensure that this integrated approach is relevant for the nuances of a particular country and the nuances of a particular patient. Across select LMICs in Africa, the Middle East, Southeast Asia, and Latin America, there are 4 initial NCD focus areas that we've embarked upon with MAPS. These are hypertension, dyslipidemia, depression, and chronic pain. As we look at the possibility of replicating this, cross-country and regional synergies based on common themes identified through MAPS will be used to drive discussions and collaborative strategies needed to accelerate the momentum on controlling NCDs in other low and middle income countries with similar cohorts and similar circumstances. Therefore, the applicability of MAPS, as has already been pointed out, is not limited to a specific disease state or a particular geography. We think MAPS better positions us to deliver on ensuring something that's very near and dear to our heart at Upjohn, very much embedded in our vision, that every patient everywhere have access to affordable quality care, regardless of where one lives or depending on the socioeconomic conditions. The local insights gained through these initiatives will help transform the patients, families, healthcare providers, but I kept talking about the healthcare systems as well, because it's not just about resourcing. Even in well-resourced instances, we see gaps, and there's ways to be able to optimize the healthcare system to be more productive and more responsive as we go forth. It's important to note that none of this is possible without a multi-sectorial approach. So as I said to begin with, we're greatly appreciative of Dr. Ratna and IOPO, and look forward to working with you and other local partners, going beyond the pill and going into policy making, medical societies, to be able to have the intended outcomes that we all strive for. So prior to me saying thank you very much and handing it over to Dr. Devi to close us out, as Amr pointed out, we'd like to share a brief video that provides an overview of MAPS. Thank you very much.
MAPS. Mapping the patient journey towards actionable beyond-the-pill solutions. An evidence-driven, patient-centric, and action-oriented framework created to identify the most needed areas in the NCD patient journey across 12 emerging markets. Each stage of the patient journey is addressed and focused on improving disease management outcomes. The patient journey: awareness, screening, diagnosis, treatment, adherence. A fundamental aspect of MAPS is capturing and amplifying the patient voice. This enables stakeholders to fully understand the complexities of the patient journey. With patients in the center of strategic development and scientific conversation, MAPS can be the cornerstone to strategically facilitate multi-stakeholder partnerships that have high impact for the long term.
Thank you for that video, and I hope people enjoyed watching it. I'd just like to leave this session with two thoughts. One is, we talked of 5 touch points, but how has the pandemic changed those touch points? Have those touch points disappeared, or have they become more convoluted and complex? And how can we understand this? Because maybe, enough data is not there. And the second is, of course, we saw the 12 countries. They are geographically very, very diverse. They have different customs and cultural contexts. And how is the data that's going to be captured, help us understand, as Dr. Ray pointed out, local solutions? Because I think if we have to achieve any of the goals of the SDGs, then it has to be more local, more contextual, and more, in touch with reality on the ground for it to be acceptable to the patients as well as the healthcare providers. With that, I'd like to thank both our speakers, Dr. Ray and Manasi. Thank you very much, and look forward to further collaboration on this very exciting initiative. Thank you.
Thank you very much, Dr. Ratna and Manasi and Dr. Ray. This session actually leads on directly into something that's almost touching and almost, in fact, meshing so well, but fragmented healthcare. So I would ask you to join us in that fragmented healthcare, but convoluted healthcare systems, silos, and how we can improve them. I think your journey will be very good to point us in the right direction. So I'm asking the audience to leave this session, go back to the auditorium and join us again. And we'll continue this line of thought more detailed, because I think we've got AI and other technologies to get a very good map on where we are going. Thank you very much, and see you at the next session.
Thanks, Kuldeep. Thank you, everyone. Thanks, Ratna. Thanks, Manasi.
Thank you.
Thank you very much, everybody.